Title of my video is Peer Role Play in Virtual Medical Clinic, an innovative approach to facilitate experiential learning. I hear, I forget. I see, I remember. I do, I understand. I reflect, and I learn. This is a famous quote said by a well-known Chinese philosopher Confucius 2500 years ago, but it proved to be very true. The real situation of attaining the competency by experiencing and then reflecting on it. Peer role play is a well-known effective education method as it provides positive clinical learning. Virtual medical clinic is a modality developed by e-learning team and faculty of International Medical University. It creates a platform for clinical cases by using the latest virtual reality technology available today. We have incorporated role play and virtual medical clinic, two platforms of teaching together to maximize clinical learning. When we use role play in virtual medical clinic, then it provides insight into case-based learning by experiential learning, which helps to enhance all domains of learning that include knowledge, communication, and psychomotor skills. Experiential learning is quite simply learning by doing. It can be defined as an engaged learning process whereby students learn by doing and by reflecting on the experience. In 1984, David Cole, a psychologist from USA, described effective learning in four stages in his famous cycle of experiential learning, which can be achieved in our model. First, by experiencing as a role player, then reflecting, developing a concept, and finally applying into real clinical practice. Here is a list of orthopedic cases in the virtual medical clinic with a QR code. Cases looks like this at the e-learning portal. Here you can see two students are playing role of a doctor and a patient according to the script. Role play in a virtual medical clinic is a novel model as it gives insight into the clinical case to prepare you to react in the clinical situation. Further, critical thinking improves competencies. Pair observing the whole scenario learned by reflecting observation. The virtual medical clinic is an initiative by the academics of IMU and e-learning team to create a platform of cases by using the latest virtual reality technology available today. This is a case of left elbow injury. Learning outcomes are clearly defined in the first slide, which should be achieved by the end of this session. Here is an example of a role play in virtual medical clinic. One student acting as a doctor as well as facilitator and other as a patient as well as a learner. In this case of elbow injury, the doctor is taking history from the father. In the other slide, you can see the facilitator is asking about the clinical signs on examination. Here, the facilitator is assessing the anatomy of the elbow, then asking the clinical test of peripheral nerves that could be injured in this case. After history and examination and revising anatomy of the elbow, facilitator is asking about the differential diagnosis. AP and lateral radiographs of the elbow are shown to identify the details about the fracture. After showing the radiographs, facilitator is asking about the final diagnosis and the treatment options. In this slide, treatment is shown which is done by the K-wire. Here the facilitator is exploring complication of the treatment and then how to assess it. Role play in virtual medical clinic is being used in orthopedic posting in semester 7 due to limited access to hospital-based clinical training. Students have given very promising and encouraging feedback which is represented by the graph. They insist to include in the curriculum even after the normalization of the pandemic situation. Now I will show you few clinical cases prepared by other disciplines for virtual medical clinic. Case prepared by medical department, sudden chest pain, head injury prepared by emergency department, lateral neck swelling by ENT, sudden loss of vision by ophthalmology, and painful swelling in the jaw by dental department. In conclusion, peer role play in a virtual medical clinic provides an excellent platform for experiential learning and prepares students for the real clinical setting. Thank you.